Have you ever wondered what happens when you're put under anesthesia? It's a journey to the unknown, a mystery that's been part of medicine for centuries. Anesthesia, a practice utilized to prevent patients from feeling pain during surgery, is a fascinating yet often misunderstood concept. It's not just about sleep, but a complex process that involves the careful balance of unconsciousness, muscle relaxation, and pain relief. So buckle up as we dive into 28 dark facts about anesthesia that you probably didn't know. Anesthesia's roots date back to ancient times, but its history is not all bright. In the far reaches of antiquity, humans sought to conquer pain using what nature provided. Ancient civilizations, for instance, turned to opium poppies and alcohol to numb their senses during medical procedures. The results, however, were often unpredictable and fraught with danger. As we moved into the 19th century, medical advancements began to offer safer alternatives. One of the most remarkable moments in the history of anesthesia occurred in 1846. A dentist by the name of William Morton made a public demonstration of ether's anesthetic properties. This was a game changer. For the first time, surgery became less about endurance and more about healing. Yet the journey of anesthesia was not without its dark chapters. From addiction issues to fatal accidents, the path to modern anesthesia was paved with trials and tribulations. So, anesthesia has come a long way, but its journey has been far from smooth. Let's delve into some of the dark facts about anesthesia. Our first dark fact takes us back to the 19th century. Anesthesia, in its early days, was as dangerous as the conditions it was meant to alleviate. The lack of precision in dosing often led to overdose, causing patients to slip into a coma or, in the worst cases, lose their lives. Moving on to our second fact, anesthesia awareness. This is a rare but petrifying condition where patients remain conscious during surgery. Picture this. You can't move or speak, but you can feel every incision, every tug and pull. It's as horrifying as it sounds. Thirdly, postoperative cognitive dysfunction, or POCD, is a lesser-known side effect of anesthesia. This condition causes memory and concentration problems, especially in older adults, and can last from a few days to several weeks. Our fourth fact is not for the faint-hearted. Anesthesia can cause a rare and deadly reaction known as malignant hyperthermia. This condition triggers a rapid increase in body temperature and severe muscle contractions, which can be life-threatening if not treated immediately. The fifth fact is about local anesthesia. Even though it's considered safer, it's not without risks. If it enters the bloodstream, it can cause seizures, respiratory failure, and even cardiac arrest. As we move to the sixth fact, it's important to mention that anesthesia, while saving countless lives, can be a silent killer. Allergic reactions to anesthetic drugs, though rare, can lead to anaphylaxis, a severe, potentially fatal allergic reaction. Lastly, for our seventh dark fact, let's talk about the emotional toll. Waking up from anesthesia can be disorienting and frightening. Many patients report feelings of confusion, fear, and even hallucinations. This can be particularly distressing for patients with pre-existing mental health conditions. That's just the tip of the iceberg. There's more to come. Continuing our journey into the hidden aspects of anesthesia, let's delve into the next 7 dark facts. Our 8th fact takes us back in time when anesthesia was misused. In the late 19th and early 20th centuries, anesthesia was often used in asylums to subdue and control patients. This misuse of anesthesia is a stark reminder of the ethical responsibilities that come with any medical advancement. Moving on to our 9th fact, did you know that anesthesiologists play a crucial role in surgeries, often overlooked by the public eye? They are not just there to put you to sleep. An anesthesiologist is essentially a guardian angel, monitoring your vital signs and making lightning-fast decisions if anything goes awry. This leads us to our 10th fact. Determining the right dosage of anesthesia is a significant challenge. Too little, and the patient might wake up or feel pain during the procedure. Too much, and the patient could slip into an irreversible coma or even die. It's a delicate balance that requires extensive training and experience. Our 11th fact is a chilling one. Anesthesia awareness, a rare but terrifying phenomenon, occurs when a patient becomes conscious during surgery. They can hear, feel, but are unable to move or communicate. It's a nightmarish scenario that underscores the importance of getting the dosage just right. The 12th fact is about the side effects of anesthesia. From nausea and vomiting to confusion and memory loss, the after effects can be quite unpleasant. In rare cases, anesthesia can even lead to serious complications like stroke or heart attack. Anesthesia isn't just for humans, as our 13th fact demonstrates. It's also used in veterinary medicine. But the dark side here is that it's even trickier to get the dosage right for animals who can't tell us how they're feeling. Finally, our 14th fact is about the unknowns of anesthesia. Despite its widespread use, there's still so much we don't understand, including exactly how it works at a molecular level. This mystery adds an extra layer of darkness to our understanding of anesthesia. Anesthesia is indeed a double-edged sword, isn't it? Still with us? Good, because we're not done yet. Let's dive into the next 7 dark facts about anesthesia. Fact number 15. Anesthesia can lead to post-operative cognitive dysfunction. This term refers to a decline in cognitive performance following surgery. It's not just about feeling a bit foggy after waking up. This can mean serious problems with memory, concentration, and even personality changes. Number 16. Elderly patients are at a higher risk. As we age, our brains become more susceptible to the effects of anesthesia. This means the elderly are more likely to experience post-operative cognitive dysfunction or even delirium. Fact 17. Anesthesia can cause delirium. This is a severe confusion that can last for days or even weeks after surgery. Patients may not recognize family members, have hallucinations, or become agitated and aggressive. Moving on to number 18, general anesthesia is still not fully understood by scientists. Despite its widespread use, the exact mechanisms of how it works remain a mystery. This is partly due to the complexity of the brain and the variety of anesthetic agents. Fact 19, anesthesia can have long-term effects. Studies have suggested that exposure to anesthesia over the long term, especially in early childhood or over multiple surgeries, may lead to lasting cognitive impairment. Number 20, anesthesia can cause a rare but severe reaction called malignant hyperthermia. This is a rapid and dangerous increase in body temperature that can be triggered by certain anesthetic agents. And finally, fact 21, anesthesia can lead to post-operative vision loss. This is a rare but devastating complication, particularly associated with spine surgery. The exact cause is unknown, but it's believed to be related to changes in blood flow to the optic nerve during surgery. Surprising, isn't it? But hold on, we still have more. In our final dive, let's uncover the last batch of dark facts about anesthesia. Starting with fact 22, did you know that anesthetic gases are not entirely eco-friendly? That's right, gases like nitrous oxide and desflurane are potent greenhouse gases. They can linger in the atmosphere for years, contributing to global warming. It's a surprising and often overlooked impact of our medical advancements. Moving on to fact 23, anesthesia can be lethal if self-administered. There have been numerous reported cases of individuals attempting to self-medicate with anesthesia, often leading to tragic outcomes. The precise administration of anesthetics is a sophisticated process and should only be conducted by trained professionals. Fact 24 is a sobering one. In many parts of the world, safe and effective anesthesia is not readily available. This lack of access can lead to unnecessary suffering during surgical procedures and can even prove fatal. It's a stark reminder of the healthcare inequality that exists on a global scale. For fact 25, it's important to note anesthesia can sometimes lead to cognitive decline, particularly in older people. Post-operative cognitive dysfunction, where patients experience longer-term cognitive impairment following surgery, is a recognized phenomenon. Fact 26 reveals anesthesia is not without its financial implications. The cost of anesthetic drugs can be prohibitive, particularly in developing countries. This often leads to a reliance on older, less effective drugs. Our penultimate fact, number 27, is that anesthesia can lead to rare but serious complications such as malignant hyperthermia. This severe reaction to certain drugs used during general anesthesia can result in a high fever and severe muscle contractions. Finally, fact 28. Despite its potential risks and complications, anesthesia remains an essential tool in modern medicine. Without it, many life-saving procedures would simply not be possible. It's a testament to the continual evolution of medical science, even while acknowledging its darker aspects. And there you have it, the 28 dark facts about anesthesia. That was quite a journey, wasn't it? We've delved deep into the enigmatic world of anesthesia, from its origins to 28 surprising dark facts. We've uncovered its grim past, peculiar effects, and the potential risks, reminding us that even in modern medicine, shadows lurk. Yet it's crucial to remember these facts aren't meant to instill fear, but to emphasize the importance of informed consent. Next time you encounter anesthesia, you'll be armed with knowledge, and remember, every medical intervention has its risks and benefits.